everyone, and welcome back. Today, we're going to do a deep dive into CVS and their recent financial performance.
Oh, yeah.
We're looking at their Q3 2024 report and all the extra notes that come with it.
Right.
And there's a lot to dig into here.
Absolutely.
So we'll be talking about all their different business segments, like managing pharmacy benefits and health insurance. And of course, we all know those corner drugstores.
Yeah.
So get ready for some pretty surprising stuff. Like, did you know that CVS is closing over 270 stores?
Really?
Yeah. So we're going to take a look at what that means for their overall strategy.
Interesting.
Also, what's the story with all those billion-dollar opioid settlements?
Yeah, we'll definitely have to get into that.
For sure. And we'll also be exploring how things like people using Medicare more and the ACA's star ratings are actually impacting their bottom line.
You're right. It's really not just retail pharmacy anymore. It's like a snapshot of the whole healthcare landscape.
It really is.
Yeah.
So let's start with the big picture. For the first 9 months of 2024, CVS saw the revenue grow by 4.2%.
Okay.
So that sounds good, right?
Yeah, it does. But here's where it gets interesting. Despite the revenue growing their net income, the profit that can be attributed to CVS Health dropped by a massive 52.8%.
Whoa. Okay. That's a huge difference.
It is.
Why would their profit plummet like that when revenue's actually going up?
Well, that's the question, isn't it?
It is.
To really answer that, we got to break down how each part of their business is doing. Like, think of CVS as a big house with a bunch of different rooms.
Okay. I like
Each
that.
one has a story to tell.
So which room are we going into first?
Let's start with healthcare benefits. That's their health insurance part of the business.
Okay.
So in those first 9 months of 2024, they actually saw pretty amazing revenue growth, like 23.8%.
Wow.
But before we start celebrating, remember that big drop in their total profit we talked about?
Uh-huh.
Well, in this part of their business, their operating income went from a profit of almost $5 billion in 2023 to a loss of $746 million in 2024.
Wow. That's a big turnaround.
It is.
So what happened?
Well, a big part of it is more and more people are using their health insurance.
Right.
And, that means higher medical costs for CVS.
Right.
Sometimes more business isn't actually good business, especially when costs go up faster than the money they're making.
Yeah, that makes sense. If more people are using their insurance, then CVS has to pay out more in claims.
Right.
But is that the only reason they're losing money?
Well, there's more to it. Remember how a lot of people signed up for Medicaid during the pandemic?
Mm-hmm.
Well, a lot of those new patients are sicker than expected, which is leading to even higher costs for CVS.
Oh, so it's like a double whammy?
It really is. And on top of that, CVS had to put aside $1.1 billion. It's called premium deficiency reserves.
Okay.
It's basically a safety net to cover potential losses.
Right.
A lot of that is because of challenges with their Medicare and individual exchange plans. They're thinking some of these plans might actually lose them money.
Oh, so they're just trying to be careful and plan ahead. But what about those Medicare star ratings? I've heard those can affect how much money an insurance company makes, too.
You're right. Some of CVS's Medicare plans got lower star ratings, and that means less money from the government.
Oh, wow.
These ratings, they're based on things like how satisfied patients are and the quality of care they get.
Right.
And that has a direct impact on how much the government pays.
So CVS is really facing a lot of problems in this area.
Yeah.
I mean, you've got more people using their insurance.
Yes.
And those people are sicker than they thought.
Mm-hmm.
And then there are those potential losses and less money from the government.
Yep. That's not exactly the best recipe for success, is it?
It's not.
And when we zoom out a bit, it all kind of points to this bigger trend of healthcare costs just going up and up.
Yeah.
Insurers are struggling to manage these costs and still, compete in the market.
Right.
Yeah.
Okay, so we've looked at one room of the CVS house.
Uh-huh.
What about their role in pharmacy benefit management?
That's our next stop. So CVS's health services segment, that's where they handle things like prescription drug plans and mail-order pharmacies.
Okay.
They're like the middleman between you, the drug manufacturers, and the insurers.
Mm-hmm.
Interestingly enough, their revenue actually went down in this segment, but their adjusted operating income actually went up.
Wait, how's that even possible?
Yeah, it's kind of counterintuitive,
Yeah.
but it really shows how complex this type of business is.
You're right.
They bought Oak Street Health and Signify Health.
Right.
They're trying to be more involved in primary care and home health.
Yeah.
And that's probably why their operating income looks better in this segment.
So they're trying to do more than just fill prescriptions. They want to be more involved in our overall healthcare.
Right, exactly.
But is that enough to make up for the loss in revenue?
Well, it's a bit early to say,
Yeah.
but it's definitely a big part of their strategy.
Okay.
Another thing is they're giving more rebates and discounts to their clients,
Okay.
which is great for consumers,
Yeah.
but it squeezes their profit margins, you know?
Right.
It makes you wonder how long they can keep doing that. Can they keep offering lower prices without hurting their profits? It's a delicate balancing act.
Yeah, they're trying to find that sweet spot where they keep customers happy but still make money.
Exactly.
But something else I noticed in the report, the number of pharmacy claims they processed actually went down.
Oh, yeah?
Yeah. So what's
Mhm.
going on there?
That's something to keep an eye on, for sure.
Okay.
It could mean things are changing in the whole pharmaceutical market,
Right.
which could affect how much money they make in the future.
So we've got people using more healthcare services, which is affecting their insurance business,
Right.
and some big changes happening in how they handle prescription drugs.
Mm.
What about those traditional retail pharmacies that we all see?
Ah, that's the part everyone knows the
All
best.
right.
They sell everything from prescriptions and vitamins to greeting cards and snacks.
Exactly.
It's called pharmacy and consumer wellness, and it's a big part of their business.
It's the CVS we all know and love. So how are they doing there?
Well, the revenue's up in this area, but their adjusted operating income is only going up very slightly.
So what does that mean?
It means they're still facing pressure on their profit margins.
Right.
They did get more business from prescriptions and vaccinations,
Mm-hmm.
and they've been smart about buying drugs,
Okay.
but there are other things working against them.
You mentioned some store closures earlier, right?
Oh, yeah, get this. CVS is planning to close 271 stores in 2025.
271 stores. That's a lot.
It is. It's a big change, and it probably reflects how people are shopping differently these days.
Right. Everyone's buying stuff online.
Exactly.
And I guess they're also facing pressure from all those other healthcare companies out there.
It's a classic example of a company trying to adapt to a changing market. They want to stay ahead of the game.
So it's not just store closures. Their front store sales are also down. I guess we're not all buying as much candy and shampoo at the checkout counter anymore.
Well, it's probably because people are spending their money differently in general. And maybe we're not stocking up on COVID tests like we used to.
Thankfully not.
Thankfully not.
Okay, so we've talked about insurance and prescriptions, but
Yeah.
what about that last piece of this CVS puzzle, their corporate other segment?
Ah, yes. That's where they lump all the administrative costs and older businesses like long-term care insurance.
Okay.
It's not really the most exciting part.
Yeah.
Revenue's down and operating losses are up.
So it's just the cost of running a big company like CVS Health.
Pretty much, and like with any giant company, it's tough to manage those costs effectively.
Okay, so we've had a pretty whirlwind tour of CVS's finances,
Yeah.
and it sounds like a bit of a mixed bag.
Yeah.
But before we talk about the main challenges and what it all means for us, let's take a closer look at some details from the report that I found pretty interesting.
Okay, sounds good. Let's hear it.
Okay.
Yeah.
Okay, so those GLP-1 drugs everyone's talking about for weight loss and diabetes?
Hmm.
Well, it seems like there are shortages of those drugs.
Right.
And that's affecting CVS's ability to, offer savings to their clients in that pharmacy benefits management business we talked about.
Ah, so it's kind of like a domino effect, huh?
It is.
Even a small hiccup in the supply chain can really mess things up for everyone you know.
Exactly. And speaking of prices, CVS is facing lawsuits over something called usual and customary pricing.
What's that?
Basically, it's about claims that their retail pharmacies were charging too much for medications.
Oh, wow. So it's kind of a legal headache for them.
Yeah, and it shows how complicated the whole healthcare industry is with all these rules and regulations.
Yeah, for sure.
And then there are those opioid settlements. Those aren't going away anytime soon.
No, they're not.
CVS and all those other big companies involved in selling drugs are still dealing with the consequences of the opioid crisis.
Right, and those settlements are a huge reminder that,
Mm.
dispensing powerful drugs comes with a lot of responsibility.
Absolutely.
The opioid crisis has been devastating for so many communities,
It really has.
and the fallout from that is far from over.
Okay, so we've got legal battles and settlements. But wait, there's more. Some shareholders are suing CVS saying they weren't honest about their long-term care insurance business.
Oh, wow.
Yeah, it seems some investors aren't happy with how things have gone.
Well, it does highlight how important it is for companies to be transparent,
Right.
especially when it comes to their finances.
For sure. And on top of all that, those credit rating agencies are starting to worry about CVS's future.
What are they saying?
They're even suggesting that CVS's debt ratings might be downgraded.
Huh, that's not good.
It's not a good sign.
Oh.
If their ratings go down, it'll be harder and more expensive for them to borrow money.
Right.
And that could affect their ability to grow in the future.
Okay, so we've got legal problems, settlements,
Hmm.
unhappy investors, and now worried credit agencies. It sounds like CVS is in a tough spot.
It does, but remember, they're also making some big changes to try and adapt, like buying Oak Street Health and Signify Health.
Right, those are smart moves.
They're really pushing into primary care and home health care.
Yeah, they're trying to stay ahead of the curve.
But is it enough?
Well, that's the big question, isn't it? But when we look back at everything we've talked about, there are some key themes that really jump out.
Okay, let's hear them.
Yeah,
First off, we've got all this pressure from people using more healthcare services
right. Like they're filling more prescriptions, going to the doctor more often.
and ending up in the hospital more.
And that's putting a lot of strain on CVS's different business segments.
Right. It's not just a CVS problem, though, is it?
Not at all. It's happening all over healthcare.
Yeah.
People are getting older. More people have chronic illnesses.
Hmm.
And maybe there's some pent-up demand from the pandemic years, too.
So all of this is leading to higher costs for everyone.
It is. And it means you might see your insurance premiums go up, or maybe even changes in what your insurance covers.
That's something to watch out for.
It is.
And then there's all the uncertainty around government regulations and policies.
Right. Healthcare is super regulated.
And CVS is right in the middle of it all.
They are.
Any changes to healthcare reform or how Medicare and Medicaid pay could really mess with their finances.
It's a perfect example of how politics and business are totally intertwined.
Yeah, decisions made in Washington can directly affect a company's profits.
Absolutely. And
Mhm.
CVS is no different.
And speaking of political hot potatoes, we can't forget about all the scrutiny of those pharmacy benefit manager.
Yeah, there's a lot of talk about regulating them even more.
And that could have a big impact on this part of CVS's business.
It could completely change how prescription drugs are priced and dispensed, which could affect your out-of-pocket costs.
Oh, wow.
Yeah, that's a big deal.
Okay, so we've got rising healthcare costs, government uncertainty, and all this pressure on their pharmacy benefits management business. But there's one more thing.
What's that?
Good old-fashioned competition.
Oh, yeah.
CVS isn't just competing with other drugstores anymore.
Right.
They're up against those online giants like Amazon, and they
Mm.
have to deal with changing consumer behavior and all these new healthcare companies popping up.
Yeah. It's a whole new ballgame.
So they've got to be really innovative and quick on their feet if they want to stay ahead.
Absolutely.
So we've talked about a lot of challenges, rising costs, government regulations, competition, all that stuff.
We have.
But what does it all mean for the average person who shops at CVS or uses their services?
Well, even if you don't get your prescriptions filled at CVS or have their insurance petitions, these trends are important for everyone
Okay, why?
because they show us what's happening in the whole healthcare system.
Right.
We're all feeling the pressure of rising costs,
Mhm.
and we're seeing how healthcare businesses are changing.
Yeah.
And the future is pretty uncertain.
It is.
It's important to stay informed so we can make smart decisions about our own health.
Absolutely. Being in the know helps us take control.
It does.
Okay, so we're wrapping up this deep dive into CVS, and they're clearly at a crossroads.
They got.
They're facing all these challenges and trying to make big changes.
Yeah, like closing stores and getting into primary care.
Right.
It's a big gamble.
Will it be enough to get them back on track and making money again?
That's the million-dollar question, isn't it?
Yeah.
We can't predict the future, but we can look at what they're doing now and try to guess what might happen.
Right, and that leads me to the final thought I want to leave everyone with today.
Okay, let's hear it.
So CVS is at this crossroads, right? They've got these challenges, they're changing things up. Will it work? Will they make a comeback? And I guess, what does it mean for us, for people who need health care,
Yeah, it's tough to say for sure. The whole healthcare world is changing so fast. CVS is trying to adapt. Will they succeed? We'll see. But their story kind of tells us what's happening in healthcare overall. Their choices affect everyone.
So they're like a test case.
In a way, yeah. What happens to them could show us what's coming for all of us.
That makes sense. So we got to keep watching.
Definitely. And it's important to understand these big trends in healthcare to make good choices for ourselves.
Absolutely. Okay, everyone, that's our deep dive into CVS. It's a complicated story, but it's important. We'll keep you updated as things develop. Until next time, stay curious, stay informed, and most importantly, stay healthy.